If you feel a sharp, nagging pain on the outer side of your elbow every time you grip a coffee mug, turn a doorknob, or shake someone's hand, you might be dealing with tennis elbow. The medical name is lateral epicondylitis, and here's the surprising part. Most people who get it have never picked up a tennis racket in their life. It's one of the most common elbow complaints I see, and the good news is that it usually improves with the right care. In this video, I'll walk you through what's actually happening inside your elbow, why it hurts, and the practical steps that tend to help. Think of this as general education from an orthopedic perspective, not a personal diagnosis, so let's get into it. To understand tennis elbow, picture the muscles that run along the back of your forearm, the ones that lift your wrist and fingers upward. These muscles all funnel into a single tough tendon that anchors onto a small bony bump on the outer elbow called the lateral epicondyle. Every time you grip, lift, or twist, that tendon takes the load. When you repeat those motions over and over, especially with poor technique or without enough rest, tiny tears can build up faster than the tendon can heal. Over time, the tissue becomes disorganized and weakened, which is why doctors now describe it as a tendon breakdown rather than simple inflammation. That's why gardeners, painters, plumbers, cooks, and people who spend hours at a keyboard or mouse are just as likely to develop it as athletes. The classic sign is pain and tenderness right over that outer bony bump, often spreading down into the forearm. It typically flares up with gripping tasks, lifting a milk jug, wringing out a towel, or straightening your fingers against resistance. Some people notice a weakened grip, like objects slipping out of their hand unexpectedly. The pain usually builds gradually over weeks rather than starting from one single injury. In most cases, a clinician can diagnose tennis elbow from your history and a simple physical exam, without needing scans. Imaging like ultrasound or MRI is reserved for stubborn cases or when the picture isn't clear. If your symptoms don't fit this pattern, it's worth getting checked, because nerve irritation and other elbow problems can sometimes feel similar. Here's the reassuring part. The large majority of tennis elbow cases get better without surgery. The first goal is to calm things down by reducing the activities that trigger the pain, not stopping everything, but modifying how you grip and lift. Many people find relief with a forearm counterforce brace worn just below the elbow, which takes some load off the irritated tendon. Ice after activity and short-term use of over-the-counter pain relievers can help with flare-ups, though you should check with a pharmacist or doctor about what's right for you. Patience matters here, because tendons heal slowly, and this condition often takes weeks to months to settle. Treatments like steroid injections may give short-term relief but aren't always better in the long run, so they're a conversation to have with your own physician rather than a default fix. Once the sharp pain settles, gentle strengthening is often the key to lasting recovery, because a stronger tendon tolerates load better. One of the most studied approaches is slow, controlled wrist exercises that focus on the lowering phase of the movement, sometimes called eccentric loading. A simple version is to support your forearm on a table, hold a light weight with your palm facing down, slowly lower your wrist, then use your other hand to help lift it back up. Gentle stretching of the forearm by extending your elbow and easing your wrist downward can also improve flexibility. The rule of thumb is mild discomfort is okay, but sharp or worsening pain means back off. Progress should be gradual over weeks, and a physical therapist can tailor a program to your situation, which is especially helpful if you're unsure about technique. So when should you stop self-managing and get evaluated? See a clinician if the pain follows a sudden injury, if you notice numbness, tingling, or weakness spreading into your hand or fingers, if the elbow looks swollen, red, or hot, or if you have fever along with it. Also seek care if the pain is severe, keeps waking you at night, or simply isn't improving after several weeks of sensible self-care. These can signal something other than ordinary tennis elbow that deserves a closer look. To recap, tennis elbow is an overuse problem at the outer elbow tendon. It's very common even in non-athletes, and most cases improve with activity modification, a brace, and gradual strengthening. Be patient, listen to your body, and partner with a healthcare professional for a plan that fits you. Thanks for watching, and take care of those elbows.